Okay, I think I've got everything. Okay, my name is Haley. For this video, I am going to be showing how I would do a sterile dressing change. Um, I, I'm not in the lab today, so for the purpose of this video, I have I got like a wound, I guess it's a wound out of my body parts bag, and this is what I have here, and this is going to be my patient, and then I've got everything else kind of set up. Okay, so when I would, after I checked the doctor's orders and verified that, the patient is due for a sterile dressing change, I would come into the room, knock on the door. I would, introduce myself to the patient. Hi, how are you today? What's your name and date of birth? I'm going to check the bracelet and make sure that that's accurate. I am going to ask the patient, do you have any allergies that aren't listed on your chart? And then I'm going to do a pain assessment. Can you tell me right now, what is your pain on a level from 0 to 10, 0 being no pain at all, and 10 being the most pain you've ever had. Hopefully, their pain is at a manageable level, so, something that they can, be okay with, that's acceptable to them. Then I am going to, of course, get their bed ready, like, raise it to where I need it to be. I'm going to, practice my general principles and safety practices. I've got all my equipment ready. I'm going to come in, I'm going to do hand hygiene. So we're just going to pretend I have a sink here. I've got these, which I'm using. I'm kind of short on supplies, sorry. I've got these, which are technically sterile gloves, but I'm going to use them as regular gloves for right now. But I would put my regular gloves on after doing my hand hygiene. Because we're wanting to, remove the dressing before anything. So whenever we go over to the patient, and this is the wound, like I said, we're going to want to carefully remove the dressing. We're going to start, on the tape from the outside. And just gently take it off of their skin. Okay. Which is a little difficult to do on this tray, but alright, so we're going to gently take the tape off. And I'm going to remove it right here. Okay, and then after I remove the dressing, I'm going to look at it. I'm going to document, at the end of this, I would want to document any drainage that is on the dressing, the color of the drainage, the consistency, how much is there, all of that. Looks good, the wound looks good, everything's okay with that. Alright, now that I'm done with that, I'm going to take my gloves off. And we're just going to get the sterile field ready. That way we can go ahead and do the sterile dressing. So whenever you do a sterile dressing, here's my little sterile dressing kit. You have to open the package away from you. So we're going to open it up. Okay, and then the sterile field cover is right here, so I just kind of want to pick it up on the edge here. Okay. And then I'm going to just gently put it right here. I don't want it to touch anything. I want it to be, completely sterile. And this is like me making my sterile field. Okay, so it's not touched anything. Everything's good. Like I said, we just want to pick it up in the corners, just like an inch away from the border. I'm going to take my little sterile kit, and I'm just going to dump it. Okay, and then I'm going to put my sterile gloves on. Also, if I was doing this in a patient's room, of course, I would have a bedside table, and the bedside table would be up higher because for the sterile field and for the process of doing any kind of, sterile technique, I would want, you know, to keep my hands like above my waist at all times, and my sterile field would also be here above my waist. But for the purposes of this video, because I don't have a bedside table here at home, it's down a little bit lower. But okay, so I'll just throw that. We want to grab it here on that border and pull it open. Sometimes it's a little hard to get it, but okay, and I'm going to take this hand, put this one on. I'm just going to pull it up. I'm going to pull my sleeves up a little bit here. I would have done hand hygiene too before I started the sterile gloves and the sterile field, of course, but these gloves are so much fun to put on. Hopefully the patient won't watch me struggle like this. I would have probably had my sleeves rolled up too before this, I'm sorry. But we would only want to touch the, you know, inside of the gloves. After I have, you know, the sterile gloves on, I can bring this one down. Okay, and then now that we have our, you know, the sterile field, of course, for the rest of the video, I need to keep my hands up here above my waist. The wound is exposed and is ready for me to do whatever I need to. So we have swab sticks in this one. I'm going to take it, one swab stick out, and then I'm going to, not visible, run it down the center of the wound. We're going to run this down one side of the wound. And then we're going to run this down the other side of the wound. And then also keeping my hands up. And we also don't want to put our, you know, our arms over the sterile field. I'm sorry if this is hard to see in the video. Okay, so we have that. So I'm going to take a piece of gauze, and I want to dry around the wound. And then now that it's, you know, clean and everything, I want to get my dressing that I'm going to be putting back on the wound. We're going to cover it up real nicely there, according to how the doctor wants it to be dressed, of course. I'm going to take my tape. I'm going to tape the dressing back to the wound. Okay. And I can put my hands down now, because at this point, the sterile field can be broken. The wound has been clean. It has been dressed. So we can break the sterile wound at this point. Or the sterile field at this point, because the wound it's done. That's hidden. After I have it bandaged again, I'm going to go and take a pen or something. I'm going to put my initials and the date and time on the bandage. That way, you know, whoever comes by next knows when it was changed and if it needs to be changed again and all of that. I'm going to ask the patient how they're doing. Is their pain the same as it was when I started? You know, has there been any differences? Or, you know, on a level of 0 to 10, are they still where they said that they were? I'm going to clean up my area. you know, make sure the bed is down in the right position, do my hand hygiene, and then I'm going to leave the room and report and record and evaluate.